Our pets are beloved members of our families. We share our homes and lives with them. They can experience unexpected accidents or illnesses. Knowing basic pet first aid is crucial. These skills can make a real difference. Imagine your dog cuts its paw on a sharp rock, or your cat gets into cleaning supplies. Knowing what to do can be life-saving. It can reduce your pet's suffering. Being prepared provides peace of mind. It empowers you to take immediate action. First aid can buy you valuable time. This is crucial in critical situations. Learning pet first aid makes you a better pet parent. You can handle emergencies calmly and effectively. Provide immediate care and comfort to your furry friend. A well-stocked pet first aid kit is an invaluable resource for any pet owner. It should be kept easily accessible, and you should know the location of each item. Regularly check the expiration dates of medications and replace them as needed. Start with a sturdy, waterproof container to hold all the supplies. A plastic storage bin or a dedicated first aid bag works well. Make sure it is clearly labeled and stored in a cool, dry place. Next, gather the essential items. These include gauze pads and rolls for cleaning and covering wounds. Include adhesive tape for securing bandages. Antiseptic wipes or solution are crucial for disinfecting minor cuts and scrapes. Don't forget a pair of blunt-end scissors for cutting gauze or bandages. Tweezers are essential for removing splinters or ticks. A rectal thermometer will help you monitor your pet's temperature. Remember, a normal temperature for dogs and cats is between 101 and 102.5 degrees Fahrenheit. In addition to the basics, there are several other items that can be incredibly useful in your pet's first aid kit. These items can help you address a wider range of situations. A syringe or dropper is helpful for administering oral medications or flushing out wounds. Include a bottle of sterile saline solution for cleaning wounds and eyes. You can also use contact lens solution as a substitute. Hydrogen peroxide can be used to induce vomiting if your pet ingests something toxic. However, it's crucial to consult with your veterinarian or the ASPCA Animal Poison Control Center before inducing vomiting. This is because it can be harmful in certain poisoning cases. Include a small bottle of dish soap, not dishwasher detergent, for cleaning greasy or oily substances from your pet's fur. Styptic powder or pencil can help stop bleeding from minor cuts, especially on the nails. Finally, always keep a copy of your pet's vaccination records and your veterinarian's contact information in the kit. This will be helpful if you need to visit the vet or an emergency animal hospital. Wounds are a common pet injury. They can range from minor scrapes to deep cuts. Knowing how to properly clean and dress a wound can prevent infection and promote healing. If your pet is bleeding, the first step is to control the bleeding. Apply direct pressure to the wound using a clean gauze pad or cloth. Maintain pressure for several minutes. If the bleeding is severe or doesn't stop after 10 minutes of pressure, seek immediate veterinary attention. Once the bleeding is controlled, carefully trim any hair around the wound using blunt-end scissors. This will prevent hair from contaminating the wound and interfering with healing. Clean the wound with sterile saline solution or warm water. Avoid using hydrogen peroxide or alcohol, as they can damage tissue. Apply a thin layer of antibiotic ointment to the wound. Cover the wound with a sterile gauze pad and secure it with adhesive tape. If the wound is on a limb, you can use a self-adhering bandage to wrap the area. Change the bandage daily and keep the wound clean and dry. Section 5. Addressing burns types and first aid. Burns are another common pet injury. They can be caused by heat, chemicals, or electricity. The severity of a burn depends on the cause, duration of contact, and location. First-degree burns affect the outermost layer of skin. They cause redness, pain, and swelling. Second-degree burns extend deeper into the skin, causing blisters and more severe pain. Third-degree burns are the most serious, affecting all layers of skin and underlying tissues. They may appear white or charred. For minor burns, immediately flush the affected area with cool, not cold water for 15 to 20 minutes. Do not apply ice, as it can cause further damage. You can cover the burn with a sterile, non-stick dressing. Avoid using any ointments or creams unless directed by your veterinarian. For severe burns, chemical burns, or electrical burns, immediately seek veterinary attention. Burns can be extremely painful and prone to infection. Prompt veterinary care is crucial for pain management, infection control, and proper wound healing. Section 6. The Heimlich maneuver for pets, a life-saving technique. Choking is a terrifying experience for both pets and their owners. It occurs when an object obstructs the airway. Knowing how to perform the Heimlich maneuver can be life-saving. The Heimlich maneuver dislodges an object from the airway. Signs include difficulty breathing, pawing at the mouth, and blue gums. Time is crucial in a choking situation. Stand behind your dog, wrap your arms around its abdomen, make a fist and place it against the dog's abdomen. Give quick upward thrusts. Repeat until the object is dislodged. For cats, hold the cat with its back against your chest. Place your thumb on one side and fingers on the other. Give quick, firm squeezes inward and upward. Section 7. Heat stroke in pets. Recognizing the signs and providing first aid. Heat stroke is a life-threatening condition that occurs when a pet's body temperature rises to a dangerously high level. It is more common in hot, humid weather. Brachycephalic breeds, dogs with short noses, overweight pets, and those with underlying health conditions are particularly susceptible. Recognizing the signs of heat stroke is crucial. Symptoms include excessive panting, drooling, difficulty breathing, bright red gums, vomiting, diarrhea, lethargy, collapse, and seizures. If you suspect your pet has heat stroke, immediate action is vital. Move your pet to a cool, shaded area. Apply cool, not cold water to its body, focusing on the chest, neck, armpits, and groin. You can also drape cool, wet towels over your pet. Do not use ice water, as it can constrict blood vessels and worsen the situation. Offer your pet small amounts of cool water to drink. Transport your pet to the nearest veterinary clinic or emergency animal hospital immediately, even if they seem to be recovering. Heat stroke can cause organ damage, so prompt veterinary care is essential. Pets are curious creatures, and their explorations can sometimes lead to poisoning. Common household toxins for pets include medications, both human and pet, cleaning products, pesticides, antifreeze, chocolate, grapes, raisins, onions, and certain plants. The symptoms of poisoning can vary depending on the substance ingested. Common signs include vomiting, diarrhea, drooling, lethargy, loss of appetite, tremors, seizures, difficulty breathing, and collapse. If you suspect your pet has been poisoned, time is of the essence. First, try to identify the poison and gather as much information as possible, such as the amount ingested and the time of exposure. Immediately contact your veterinarian or the ASPCA Animal Poison Control Center at 888-42-64435. They can provide guidance on the best course of action. Do not induce vomiting unless directed by a veterinary professional. In some cases, inducing vomiting can be harmful. Follow the instructions provided by your veterinarian or the APCC carefully. They may advise you to bring your pet to the veterinary clinic for further treatment. Cardiopulmonary resuscitation, or CPR, is an emergency procedure that can help circulate oxygenated blood to the brain and other vital organs when a pet's heart has stopped beating. It is a last resort and should only be performed in life-threatening situations. If your pet is unconscious, unresponsive, and not breathing, CPR may be necessary. Begin by checking for a pulse. Place your fingers on the inside of your pet's thigh, near the groin, to feel for a heartbeat. If there is no pulse, start chest compressions. For dogs and cats, place one hand on each side of your pet's chest, just behind the front legs. Compress the chest about 1/3 to 1/2 its width. Perform compressions at a rate of 100 to 120 beats per minute. If possible, alternate chest compressions with rescue breaths. Close your pet's mouth and cover its nose with your mouth. Give 2 gentle breaths, watching for the chest to rise. Continue CPR until your pet shows signs of life or you reach a veterinary hospital. Broken bones and fractures are serious injuries that require immediate veterinary attention. They can be caused by trauma, such as a fall or being hit by a car. Symptoms of a broken bone include limping, swelling, pain, and an inability to bear weight on the affected limb. If you suspect your pet has a broken bone, it's important to immobilize the injured area to prevent further damage. You can create a makeshift splint using a rolled-up towel, magazine, or piece of cardboard. Secure the splint with adhesive tape or bandages, making sure not to wrap it too tightly. Transport your pet to the veterinarian immediately. Avoid giving your pet any pain medication unless directed by your veterinarian. Some over-the-counter pain relievers can be toxic to pets. It's important to remember that pet first aid is not a substitute for professional veterinary care. It is a temporary measure to help stabilize your pet until you can get them to a veterinarian. Even if your pet seems to be recovering after first aid, it's crucial to seek veterinary attention. Veterinarians have the knowledge, skills, and equipment to diagnose and treat a wide range of pet illnesses and injuries. They can assess the severity of your pet's condition, provide pain relief, perform necessary procedures, and prescribe appropriate medications. Delaying veterinary care can worsen your pet's condition and lead to complications. In some cases, it can even be fatal. Always err on the side of caution and seek professional veterinary care after administering first aid. Your pet's health and well-being depend on it.